More than one COVID-19 vaccine is moving forward in the United States, but what happens next? Who's getting the first vaccines? How effective are they? And when do we get back to normal? I'm Veronica Rickert. This is Badger Talks. James Conway is with us today to help answer some of the big vaccine questions. He's an expert on international immunization programs, global health, and pediatric infectious diseases, and he's medical director at the UW Health Immunization Programs. Jim, thank you so much for joining us today.
Happy to be here, Veronica. Thank you.
Jim, I'm just going to go ahead and ask the big question. With a vaccine approved, when can we think about getting back to normal?
Well, it's going to take a while, Veronica. These new vaccines are going to come in waves over the next 6 to 12 months. I think we'll start to see wide-scale immunization of health workers and some of the high-risk populations over the first half of 2021. But I think until we have ability to immunize all Americans and acceptance of all Americans for vaccines, I think it's going to take a little while to get back to complete normalcy.
And let's think about how effective they are. What do we know about how effective these are going to be once people begin to get vaccinated?
Sure. Well, these first wave of vaccines, these mRNA vaccines, really appear to be highly effective. We're looking at probably 95% efficacy, which means that only about 1 in 20 people who get the vaccine will actually potentially contract the disease if they get exposed. And fortunately, they all have very mild disease. So I think we're very optimistic that the vaccines that are coming first really do seem to be at least the first step in this exit ramp that we're all looking for.
And what do we know about who's getting the first doses that are going to be hitting the populace?
Yeah, there's been a lot of discussion over these last 4 months to try to make sure we prioritize in an equitable way. The first wave is basically going to be health workers, especially those that are at high risk for exposure to COVID patients or are caring for COVID patients. But I think it was appropriate that residents of long-term care facilities, as well as the people that take care of them, are also in that very first wave. They're the group that have really been suffering the worst outcomes from these, as well as the ones that have also been flooding these hospitals and filling up hospital beds. So in that population, you actually kind of get bang for the buck twice because you protect them, but you also help take off some of the stress on the health system.
This is a tall order. Even with the vaccines approved, vaccinating an entire country, how prepared is the United States to get that job done?
Well, the good news is we have some experience in similar things. We give flu vaccine every year in a very concentrated period of time between September and December usually, and almost half the country gets a flu vaccine. So we've at least shown the capacity to do that. We've had past pandemics. People may remember the 2009 influenza A H1N1 pandemic, where we immunized really a large proportion of the country over about a 6 to 8 month period. But with that said, this is a really Herculean task. This is trying to organize and get vaccine that has very limited stability in some of these vaccines into places, especially into rural places, where we can then get it into everybody. So there's been a lot of planning, a lot of people involved. Operation Warp Speed has involved a lot of people from Department of Defense, and obviously every government agency has been part of it. But with that said, every hospital, every public health department, and really most physicians' offices and medical providers have all had at least some part of this and have been part of the conversation to try to make this go as smoothly as possible.
So far, so good, but are there any pain points you're looking for, things where it could get snarly and things could go off the rails, or any warning signs you're looking at?
Well, certainly these first mRNA vaccines are a little bit more sensitive to temperature. The Pfizer vaccine does require relatively ultra cold temperatures, both for transportation and storage. So there's been a lot of effort to make sure that that's well organized. I think the other big thing is that the way this has been portrayed in much of the messaging has led a substantial proportion of the population to be a little leery of it. I think people are used to vaccines taking years to develop. And I think with a really, all hands on deck approach, as well as a lot of money being put into it, this has really moved along very quickly in a very smooth and efficient manner. But I do think that the public is still curious and still wants reassurance that this has still been done in a way that they feel safe and comfortable.
And Jim, this has been a long slog. I know in terms of approving vaccines, it's relatively short, but as you know, living this, it has felt anything but. Can you give us some encouragement that the end of the road is in sight on this?
Yeah, I've really become quite optimistic over the last 4 to 6 weeks. As we got data from both Moderna and Pfizer with this sort of newer vaccine technology, but both of them being extraordinarily effective, that's going to be the first wave of vaccines we see, maybe 400 million doses by the second quarter of 2021. So that's almost 200 million people out of our 330 million population. And then I think we'll start to see additional vaccines coming in the first half of 2021. So I'm pretty optimistic that by summer of 2021, the majority of the population will at least start to have access to vaccine. I'm hoping that the majority will do the right thing and what is best for themselves and their families and choose to be vaccinated, so that I could see that by fall 2021, things could start looking substantially different than what we've all been living with.
Okay, summer 2021, something to look forward to. Jim, thank you so much for joining us.
Of course, thanks, Veronica.
If you have questions for us or topic suggestions or want to comment on this Badger Talk, you can send us an email at covid19update@uc.wisc.edu. And for more information, you can go to covid19.impact.wisc.edu. This is Badger Talks.